All right, let's talk about obsessive-compulsive disorder, or OCD. We're going to peel back the layers here, moving way beyond the casual jokes about being a little OCD, to get to the heart of what this clinical disorder is really all about. And trust me, it's a story of a condition that, not too long ago, was seen as both incredibly rare and basically untreatable. So I want you to think for a second. When you hear OCD, what's the first image that pops into your head? Is it someone who's super organized? A person who loves to keep their desk perfectly clean? Just hold on to that thought, because we're about to see just how wide the gap is between those common ideas and what it actually means to have a diagnosis. Okay, here's our game plan. We're going to start with what OCD really is. Then we'll get into why it's so often a hidden struggle for people. We'll look at how doctors actually put a number on it to figure out how severe it is, talk about a pretty amazing accidental discovery that changed everything, and finally, look at the rise of the treatments we have today. Right. First things first. We absolutely have to draw a clear line in the sand between the way we use OCD in everyday slang and what clinicians are looking for when they make a diagnosis. So, according to the official rulebook, the Diagnostic and Statistical Manual of Mental Disorders, or DSM, the whole diagnosis boils down to two key things: obsessions and compulsions. You can have one, the other, or both. But what do those words actually mean in a clinical sense? This is where it all clicks into place. The obsessions, those are the unwanted sticky thoughts that just barge into your mind and create a ton of anxiety. They're like a terrifying what-if question stuck on repeat. And the compulsions, those are the things a person feels they have to do, whether it's a physical action or a mental ritual, to try and shut that anxiety down. So obsessions create the fire, and compulsions are the desperate attempt to put it out. And that intense internal battle brings us to one of the biggest, most heartbreaking challenges with OCD, the fact that, for so many, it's a disorder that nobody else sees. You know, a lot of people with OCD suffer completely in silence. And you can see why. There's often this deep, profound shame, a fear that people will think they're crazy. Or sometimes they just don't even realize that what they're going through has a name, that it's a recognized medical condition. And that silence, it leads to this, an absolutely staggering delay. Research shows that, on average, a person with OCD waits 17 years from when their symptoms first start to when they actually get treatment. Let that sink in. 17 years. That's almost 2 decades of someone's life just gone to this struggle. So to try and break that silence and shrink that 17-year gap, clinicians have developed some really smart, simple screening questions. You can see how these are designed to gently open a door. Questions about washing and checking get at potential compulsions. And that one about a bothering thought, that's aimed right at the heart of obsessions. It's a starting point for a real conversation. Okay, so let's say a doctor suspects OCD. What's next? Well, the next huge challenge is figuring out just how severe it is. I mean, how on earth do you measure something that's happening almost entirely inside someone's mind? Well, they came up with an ingenious solution. It's a tool called the Yale-Brown Obsessive-Compulsive Scale, or YBOX for short, and it has become the undisputed gold standard for assessing OCD everywhere. The real genius of the YBOX is what it doesn't focus on. It doesn't care if the obsession is about germs or about safety or anything else. Instead, it measures the impact. How much of your day is this taking up? How much distress is it causing you? How much is it getting in the way of you living your life? And what this does is it takes that really complex, personal, internal experience and translates it into a single number on a scale from 0 to 40. This lets a doctor see, objectively, if the OCD is mild, moderate, or all the way up to extreme. And crucially, it lets them track over time if a treatment is actually making a difference. Now, being able to measure OCD with a tool like the YBOX wasn't just an academic exercise. It was the key that unlocked the next revolution. It's a fundamental principle of science, right? You can't really treat what you can't measure. And with a reliable measuring stick, researchers could finally prove that the first ever effective medication actually worked. And the best part? It was a total accident. Back in the 1960s, researchers were testing an antidepressant called clomiprene, and just happened to notice that it had this really unique, positive effect on OCD symptoms. That lucky break led to serious, rigorous studies in the 80s that proved it. And because of how it worked on a brain chemical called serotonin, it sparked the serotonin hypothesis, this big new idea that maybe an imbalance in the serotonin system was a root cause of OCD. And when the data from those big trials came in, the results were just jaw-dropping. Take a look at this.
Patients who got a placebo saw their Y-box scores go down by maybe 5%, but the people taking clomipramine, they saw a 44% reduction in their symptoms. This was it. For the very first time, there was real scientific proof of a treatment that worked.
The success of clomipramine was a massive breakthrough. And when you combine that with the new serotonin hypothesis, well, it basically opened the floodgates. Scientists now had a clear target, and the race was on to develop a whole new class of drugs that were even more precise. And this led straight to the development of a class of drugs that many of us have heard of today, the selective serotonin reuptake inhibitors, or SSRIs. The whole idea was to design a medication that could hit that serotonin target even more precisely, hopefully giving patients the same incredible benefits as clomipramine, but with a more manageable list of side effects.
So over the next decade or so, this whole new wave of medications came along. Drugs like fluvoxamine, fluoxetine, paroxetine, and sertraline all went through that same rigorous testing, and each one was approved specifically for treating OCD. This was huge. It totally expanded the toolkit, giving doctors and patients a whole menu of options to find the best possible fit.
So, when you step back and look at the whole story, what does it all mean? The journey of OCD, from this hidden private shame to a condition that we can now define, measure, and effectively treat, is so much more than just a history lesson. It's really a powerful, hopeful roadmap for how we can approach, understand, and maybe one day conquer other complex disorders of the human mind.